All right, assignment 711B, how to adjust pain. First case study we got, athlete, right knee pain. As they lunge forward with the right leg, pain coming right up front, right centered in the kneecap. Some probable suspects, we could be dealing with a right foot that's not everting very well. We could be dealing with a right kind of calf and Achilles complex that's stiff and lacks the ability to eccentrically load, creating dorsiflexion at the ankle. We could have a right posterior lateral hip complex and lateral hamstring complex as well that's not able to eccentrically load as that athlete goes into TZ1 of forward lunge with the right leg. Tweak we could use is to get more eccentric load out of that posterior lateral hip and hamstring complex. We'll take the right foot, internally rotate it, and that causes more eccentric load to happen to that right posterior lateral hip and hamstring, hopefully creating a more successful right anterior lunge for that athlete. Case study number 2, right shoulder pain that's up front. When the athlete presses that right arm straight overhead with the weight, with the load, with the dumbbell in hand, we could be lacking right scapular depression. As a probable suspect, we could have that scapula could lack the abduction. And both of those motions, as the arm goes overhead, hand comes up, and that shoulder goes into full flexion. We could have a thoracic spine that's limited in extension and also that's limited in left lateral flexion. We could have both hips that are limited in extension. We could have the left hip limited in extension and adduction. Right hip that's limited in extension and adduction, and the left hip is the opposite, limited in extension and abduction. We could tweak this exercise by taking the right foot. So we're going to change the foot position and go in more of an RXX foot position. Get the athlete set up. So what this is going to do is going to create a little more flexion at that right hip, and hopefully giving the athlete a more successful reach and press overhead. Case study number 3, we got an ankle that's bound up and pain is happening right in front of the ankle as that ankle loads into TZ1 of a viper squat. We could have a similar probable suspect to the shoulders. So we could have a right foot that's not everting. We could have the Achilles calf complex not allowing the dorsiflexion. We could have, again, that posterior lateral hip on the right side, hamstring that's not able to eccentrically load. And we could, same tweak we could use as we did in the shoulder press, RXX foot position. But this time, we can take the feet and externally rotate the feet. So we're going to open those feet up. And that's going to open the hips up, give the hips a little more ability to move in all 3 planes. Let them go into a squat, and hopefully that'll clean up the anterior ankle pain. Case study number 4, we've got a left lateral hip impingement as the athlete does the same side lateral lunge to the right. Here we're looking at some probable suspects. The left foot might not be everting this time. The left hip, we could have some limitation in abduction. The pelvis, we could have some limitation in its ability to just translate all the way to the right. We could have extension out of the left hip as well. And a tweak we could use is we could place the left foot in more of an everted position using a wedge. Let them go into the same side lateral lunge to the right. We could also take a bilateral hands, add more flexion to the exercise to lessen the extension out of both hips, but especially the left one. Taking bilateral hands, reaching down to ankle, and returning back.